Anita Kumar is a White House correspondent for McClatchy and joins us from Washington. Anita, good to see you. So the White House continues to push this bill despite its low approval. What's their argument for it, and does the White House seem optimistic that it could still pass?
Well, I think their argument is really simple, that Republican leaders for 7 years have been saying that they want to repeal and replace the Affordable Care Act, known as Obamacare. And they're just saying that this is better than what is there now. They want to get rid of what's there, and this is their alternative to do it. You know, they're really cautious about it. Obviously, things are not looking good, as you just mentioned. But as you heard Mark Short say yesterday, he's the legislative director at the White House, they've got all week. They've got all week to still tweak the bill, see if they can do something else, and see how they can modify it.
And they're trying to sweeten the deal to lure those GOP holdouts. They're allotting more funding to their states. Is that bribery, as Rand Paul implied? And I guess the big question, will it work?
Well, I don't know that it's going to work. If it was going to work, you probably would have heard first thing this morning that the senators from those states say, sure, we're on board. And you haven't heard that. In fact, you've heard Senator Paul, as you mentioned, say that he's not going to vote for it. So they are putting more funding. The bottom line, though, is in those states, I think the funding is still going to be lower than it is now. And that's one of the problems.
And the other issue is that senators like McCain and Collins of Maine, they have fundamental issues with the bill, from what I understand, beyond the funding. Are their concerns being addressed?
Right. I think their concerns are being heard, and you're going to see that they might try to tweak the bill as the week goes on. And so that's one issue. The other issue that Senator McCain has is this isn't regular order, and regular order means it gets more of a hearing. It gets more than one hearing that you mentioned that's happening today, and that it gets a full hearing in the United States Senate, and that's just not going to happen when the deadline is Saturday.
We are waiting for the Congressional Budget Office to score this bill today, and Senator Collins says she is waiting for their conclusion. How much could the CBO's analysis ultimately affect the vote? Will it really change minds either way?
I think the problem is the last time that we've seen the CBO score over the last few months for different bills. The problem is that when it comes out, it generally tells you how many people will be off of health care. So they'll lose their health care. And that's a bad headline to have. And so I suspect that this preliminary estimate that's going to come out today is going to say the same thing. And that's just going to be bad news for them. The other problem is it is a preliminary estimate. And some senators want the full understanding of what this bill is going to do, and they're just not going to have it this week.
One of the major disagreements, as you know, is whether the bill actually protects people with pre-existing conditions. CBS News polling has found that 87% of Americans believe insurance companies should be required to cover people with pre-existing conditions. The president has claimed he will not support a bill that does not. But are they able to make that guarantee, or will the states ultimately decide? I mean, what does the bill say?
Right. It sure doesn't sound like it's going to cover that. But yes, it leaves a lot up to the states to decide. You saw that the president tweeted the other day that he absolutely wouldn't support anything that didn't allow for pre-existing conditions. And then since then, he hasn't actually answered any more questions about it. So, I mean, it does leave a lot up to the states to decide. And it's unclear that they would be able to, guarantee that.
At the same time, the president has been claiming that the tax plan has been finalized and he expects it to go through. What happens to that, though, if Obamacare repeal efforts fail this week?
Right. This is a big week with both these two big priorities coming up. We expect to see details on the tax plan on Wednesday. Obviously, this is going to take a long time still for debate to sell it to everybody, to have the debate. So nothing's really going to happen this week, but we will finally hear some details. But it's not going to look good if the health care bill fails before then.
Okay, lastly, I want to read to you an excerpt from the New York Times over the weekend that reads, quote, over the course of just 17 hours this weekend, President Trump assailed John McCain, Chuck Schumer, Steph Curry, the National Football League, Roger Goodell, Iran, and Kim Jong-un. And that was on his day off, end quote. My question, is this all meant to be a distraction in case this week proves to be another example of President Trump being unable to fulfill his agenda?
Right. I saw that in the New York Times. You know, I'm not sure. I saw people starting to say, oh, he's just doing these tweets, or he's just tweeting the stuff about football. because he's trying to distract. This could be a very, very important week with the tax plan coming out, with the health care vote likely to fail, and then we haven't even talked about it, but the Alabama Senate race primary is Tuesday night, and he is very likely to lose. His candidate is very likely to lose. So
you mean Trump's candidate, Luther Strange,
right?
Who's the incumbent?
Right, he could lose a primary battle, and it's a tough week for him. You know, Mike Pence is there tonight. Donald Trump was out there on Friday night, so it could be a very tough week for them. I'm just not sure that he would be doing this on purpose. It's clear that he truly believes this, and he's very passionate about it because there's been so many tweets about it.
All right, so we'll talk about it more now. Anita Kumar,
thanks.
We'll let you go. Thank you.
Okay, thanks.